Guided self-help for functional neurological symptoms, your admission, how the MDT programme works. What to expect during admission. As you know, you will be admitted to hospital for our multidisciplinary treatment programme for people with functional neurological symptoms. The ward you will be admitted to is Hewlins-Jackson ward at the National Hospital for Neurology and Neurosurgery, Queen's Square. The ward has 12 beds and you will share a room with up to 3 other patients. Some of you may just share with one other patient. Inpatient treatment. There will be about 5 other people on the ward admitted for the same programme as you. Other patients on the ward will have a variety of neurological and psychiatric conditions. Just as you would lock your own front door at home, the door to the ward is locked, but you can leave at any time by asking us to open the door for you. The multidisciplinary team, or the MDT. An MDT is a team of healthcare professionals from different disciplines. Our roles complement each other and sometimes overlap. The purpose of the MDT is to ensure that your care is looked at from a number of perspectives and then planned with you to enable you to reach your goals. The 5 areas approach we have introduced in previous sessions runs as a theme throughout the programme. The multidisciplinary team. Who are we? The team consists of nursing staff. There will be an occupational therapist on your team. There will also be a physiotherapist, a cognitive behaviour therapist, and then the medical team. For some of you, you may also have a speech and language therapist if you are having problems with communication. Nursing. The nurses on the ward provide care for you over 24 hours, 7 days a week. You will have a named nurse for your stay as well as an allocated nurse for each shift. We do not have a self-medication policy on the ward, so any medications you are taking will be administered by a nurse. The level of nursing care you will require will depend on your personal needs and the goals you have set with the team. For example, you may need lots of help with personal care and admission, but you may require less and less as your admission progresses. It will really depend on what goals you set for yourself. Occupational therapy. Occupational therapy aims to challenge you in a supportive environment and also aims to reduce your reliance on others and increase your independence. Approaches such as problem solving will be used to help you maintain a balanced daily routine. We will look at problem solving tasks such as cooking, washing and dressing, catching public transport, shopping, etc. We also look at developing a relapse prevention plan and planning for the future. Physiotherapy. Physiotherapy aims to improve your movement through education, movement re-education in the gym, pain and fatigue management. Common physiotherapy treatments include walking practice with support, maybe on a treadmill or outdoors, general movement efficiency and coordination, such as teaching you how to transfer in more efficient ways. We also use mirrors and video to help refine your movement patterns and rebuild movement patterns from the ground up. Also look at increasing your movement tolerance and endurance to activity. Cognitive behaviour therapy. Cognitive behaviour therapy, or CBT, is a talking therapy that can help you manage your problems by changing the way you think and behave. Your CBT therapist will work with you to understand your patterns of thinking and how these impact on your symptoms in everyday activity. We've gone through how this works in more detail in previous presentations which have introduced you to the 5 areas approach. You may have joint sessions with CBT and other team members to put ideas into practice in everyday environments. For example, the CBT therapist might join you with an OT in a cooking session and look at your thought patterns that are going on at the time. Or you may go out with one of the physiotherapists and CBT to look at how you're dealing with movement in an environment which may be more challenging than the hospital. The medical team. You will be admitted under the care of a consultant neuropsychiatrist. You will be seen weekly in a ward round by your consultant and the rest of the team. We have specialist registrars in neurology and psychiatry, as well as a senior house officer for psychiatry. On admission, your medical history will be taken and your medication reviewed. It is a good idea to bring any medications you're taking with you. Changes in your medication may be made during your admission, and any changes will be clearly discussed with you as well as communicated with your general practitioner in a discharge letter. As you've already been diagnosed with functional neurological symptoms before admission, you will not have any further diagnostic tests while undertaking the programme. The focus of your stay instead will be on rehabilitation and symptom control rather than diagnosis, as this has already been established. Meeting the team. On the day of admission, you will be seen by members of the medical team, nursing staff and therapies. Your OT and physio assessment will usually be carried out jointly. Physiotherapy and occupational therapy assessment. This is usually a 1-hour discussion and will look at your symptoms, the impact of these symptoms in your daily activities, look at what you need help with, what type of help you need, what your goals are and your aspirations for now and for the future, what you hope to get out of the programme, and what your understanding is of your diagnosis. Now we come to worksheet number 1. If you open worksheet number 1, you will see that it has the headings similar to the ones that I've just discussed in the previous slide. It'd be an idea now to take a break, look through this worksheet and try filling in some of it. You may do this now and come back to it in the future. It may change before your admission, but it's worth getting you starting thinking about your admission and thinking about the answers to the questions you might be asked on your first day. So what do physiotherapy and OT sessions actually look like? Well, this really depends on your goals and specific problems. These may be different from your previous experiences of OT and physio elsewhere. There is a strong emphasis in these sessions on education and self-management, and we will ask you to practice activities related to your goals outside of sessions. We encourage you to look at normal everyday activity as a form of rehabilitation and exercise. Sessions will take place in various areas around the hospital, such as your bedroom. As an example of one of them. You may have some sessions in the gym. Again, it really depends on your needs and what your rehabilitation goals are. Or there may be some education sessions taking part in one of the rooms on the ward. Or around the square, which is just outside the hospital. exploring any kind of public areas such as shops, or some of your sessions may even involve using public transport. So the common session themes are understanding the diagnosis and exploring how it relates to your personal experience. So it's very much guided towards your own experience of life and how your symptoms are impacting on you. Exploring your symptoms. What makes them worse? What makes them better? Do you have any unhelpful habits? Look at pacing and planning in practice. So this will involve fatigue management and pain management. And look at exploring and troubleshooting specific barriers to recovery. These examples of this might be anxiety, panic, pain and fatigue. Look at how these impact on you in your everyday life. There are things we generally don't do in this approach. First is hands-on manipulation or massage. The kind of physiotherapy you received won't take this approach. Also, as occupational therapists, we would not recommend home modifications, equipment and rehousing. These are more long-term needs that you need to look at, and also our approach is of rehabilitation, so we try to dissuade you from using equipment if possible. Weekly goal setting. You've probably already seen the presentation on goal setting, and we use this as a basis of your therapy during your stay. And a goal setting meeting usually takes place on a Monday morning as a start to your week. In this meeting there will be a member of nursing staff, your cognitive behaviour therapist, occupational therapist and physiotherapist who all work together with you to help you achieve your goals. You will be asked to stay in hospital the first weekend of your admission so that we can get to know you and your needs. We encourage you to go on home leave the following weekends so that you can put the goals that you've been working on into practice at home. Family and friends. We've not yet mentioned the important role of your family and main support systems in your treatment. In your final week, we encourage a family meeting so we can help you explain your progress and how your family or support system can help you continue to reach your goals. Overall, our aim is to help you to develop skills and knowledge to achieve your goals and improve your quality of life. And now we come on to the second worksheet, which is at the end of this presentation. Just think about the presentation you've just watched, and on worksheet 2, which says any questions about my upcoming admission, just write down anything that you feel we haven't answered in this presentation. Thank you for listening.